So this question says, a nurse is communicating with a client on an inpatient psychiatric unit. So now the scenario changed a little bit. We're talking about a psychiatric unit, inpatient. Now, the client moves closer and invades the nurse's personal space, making the nurse uncomfortable. In other words, the patient is like right here, very close to the nurse, and the nurse is like, okay, I'm uncomfortable here. This feels weird. So what is an appropriate nursing intervention? Number one says, the nurse ignores this behavior because it shows the client is progressing. So I ask you this question. If you feel invade, your personal space is invaded, you're talking about a psychiatric patient in a psychiatric unit, your safety is compromised. Should you ignore this situation when your safety is compromised, when your personal space is being compromised by a psychiatric patient? No. You never ignore this situation. So answer number one, bye-bye, eliminated. So answer number two says, the nurse expresses a sense of discomfort and, important word, limits behaviors. So let's compare answer number one and two. Answer number one ignores the behavior. Answer number two stops the behavior. Huh? No, this is wrong. I'm not comfortable. I don't like it. You need to stop it. So answer one and two is opposite to each other. So maybe the correct answer is between them two. We know that one is not the answer. Maybe two is the answer. I see some of you selecting answer number four. Maybe, maybe not. Let's see. Answer number three. The nurse understands that the client requires various amount of personal space and accepts the behavior. What is the relationship between one and three? Exactly the same. Neither one or three does anything with this problem. And the nurse's personal space is being invaded, the nurse is uncomfortable, and safety of the staff is compromised. We know that doing nothing is not the answer. Answer 1 and 3 are similar, and 2 is opposite to 1 and 3. That is a strategy. Whenever you see answers that oppose each other, usually the right answer it is in between them. Not always, because we can never generalize, but most of the time. Answer number 4. The nurse confronts the client and states that he or she will be secluded if behavior continues. So answer number 4 also kind of stops the behavior. So we say that 2 and 4 are similar in the sense that at least in answer 2 and 4, the nurse is doing something about the problem. Now, what is the best approach? And I want you to look at these words: express and confronts. What is better in communication? What is more therapeutic? To express feelings, to express sense of discomfort, to express about the problem, or confront? Usually the word confront has a negative connotation to it. It's better to express than to confront. So in that sense, I like 2 better. Number 2 the nurse limits the behavior. In number 4, the nurse threatens the patient. If you don't stop, I will put you in seclusion. That is a threat. We do not threat patients. That is considered assault. And it's very important for you to know the difference between assault, battery, and false imprisonment. If you don't know about that, maybe we can talk about that in another video. So, answer number 4, we can eliminate it. The correct answer is answer number 2. That is the correct answer.